Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On this episode, we are going to understand more about Hyperemesis gravidarum, and I'm very excited to bring this guest to you today, Dr. Marlena Fazo. She is a women's health scientist and expert on severe pregnancy sickness. She's a researcher at the University of Southern California, research director of the Her Foundation, and chief scientific officer of Harmonia Healthcare. In our chat today, she is going to tell us more about what hyperemesis gravidarum is and what it's not, the severe impacts of this illness on people and how long it can impact people. What she has discovered is the most likely cause of HG, what people can do now to get the support that they need, and we're going to talk a little bit more about the research that she's done and still the research that needs to be done to better understand HG and how to help people who are suffering with it. We're also going to talk about some of the mental health impacts that HG has on people. For people who have suffered through HG, there's often a lasting impact on mental health that absolutely also needs to be addressed. And that's part of why I want to address it here today. One, so people can have accurate information on what HG is, and also that this is something we have to pay closer attention to so that we can make sure people are getting the help that they need. Dr. Fazo has been working in this field for quite some time, and this March she was honored as one of Time's Women of the Year, and in May she was named one of Time's 100 Health Catalysts, and in July she was awarded the 2024 Victoria J. Mastrobuono Award in Women's Health by the National Organization for Women. And it's all just so well deserved. At the end of this episode, I will give you some links where you can find out more about hyperemesis support and also give you information on an upcoming Hyperemesis Gravidarum conference in November. So let's dive in and meet Dr. Fazo. Welcome, Dr. Fazo. Thank you so much for being here.
Thank you for having me.
So in the world of perinatal mental health, anyways, your findings in your research was a big deal for us and the clients and people that we support with their mental health who are dealing with hyperemesis. So and I know it's been a big deal in your world too to be able to to find out what is at the root cause, at least, or some part of what causes HG. But before we get into that, for people who are just kind of learning about what HG is, can you talk a little bit about that?
Yes, so HG it stands for hyperemesis gravidarum, which is basically excessive vomiting in pregnancy. It is not morning sickness. It is much more severe. Patients with HG generally they cannot perform their daily routine because of the nausea and vomiting.
Mhm.
They can't do the daily tasks like take care of their children or go to work. They have dehydration that is severe enough that they require intravenous fluids.
Mhm.
Uh, Sometimes, in more severe cases, they will require tube feeding because they cannot keep down enough nutrients for their baby. Patients generally are losing weight due to nausea and vomiting rather than gaining weight in pregnancy. Uh,
Mhm.
Many patients can't even tolerate water. Patients in my studies have had their eardrums burst, their retinas detached, their esophagus tear from the violence of the vomiting. So, this is not morning sickness. It's really a severe, prolonged starvation in pregnancy and dehydration in pregnancy that can be very traumatic.
Well, yeah, and I think what people like. I'm glad you said it's not morning sickness, and what a lot of people say is like, oh, this will go away after the first whatever 3 months, but that's not the case for HG, right?
Yeah, so I mean, in some people it does go away, but there are patients where it can last the entire pregnancy, and of course that becomes more dangerous for people with HG and their fetuses if they're not gaining weight, the appropriate weight in pregnancy.
Right. So this is like debilitating, and it becomes a practice. I don't know if it's classified as a disability, but people become disabled, like they cannot live their lives.
Exactly, yeah, they can't live their lives, they can't do what they normally do. Many patients can't even leave the house or leave the bed.
Hmm.
Uh, so yes, it's very serious and very severe. Uh, Way people are treated is basically going to the emergency room
Hmm.
to get fluids and medication. Um, it's a very serious condition. We now know that it is associated with serious adverse outcomes both for the mother and for the fetus, baby, and child. Now that we have medical records that are electronic, we can link the medical records of the child to the pregnancy of the mother. And so, just in the past few years, studies have come out showing the really long term effects, including smaller brains at age 10 in children exposed in utero to HG. So,
Wow.
really severe nutritional deficiencies that are likely leading to these adverse outcomes in the children, which include increased risk of neurodevelopmental delay,
Wow.
autism, cardiac abnormalities, respiratory disturbances, increased emergency room visits, and even childhood cancer. Increased risk of childhood cancer has been associated with HG in the last year. So
Wow.
it's a serious condition.
Wow. Maybe this is not surprising to you how little attention had been paid to this for so long. I mean, you've been doing work in this area, but I mean, there wasn't a lot known for a long time. Is that accurate?
Yeah, I mean, and still not enough known and
Mm-hmm.
seriously under researched and undertreated condition of pregnancy. Patients are still often brushed off,
Mm-hmm.
treated like it's just morning sickness. So, yeah, more attention definitely needs to be given to this. Even just with normal morning sickness, the average days lost from work is 23 days, which is not sustainable for most people.
Right.
They get fired from their jobs or they have to take time away from the end of their pregnancy or delivery after delivery with their newborn. So, really, more needs to be done in this area.
Absolutely. So can you describe a bit about what your work is in the research you're doing on HG?
Yes, so I've partnered with the Hyperemesis Education and Research Foundation for over 2 decades, and we have posted surveys to collect information to answer as many questions as we can about HG. Some of the important questions, for example, recurrence risk,
Mm.
uh, and safety of medications. One of my main interests as a geneticist by training was to try to figure out the cause using a genetics approach
Mm.
so that patients could be uh, treated with medications in the future that are related to the cause and not just as band aids to the symptoms.
That seems like, of course, that's brilliant. Why not go to the very source? So what have you found?
We did a genetic study, which was well, we did. I did a few genetic studies, which were published recently, three main ones. And what we found was that the greatest genetic risk factor is a hormone called GDF15.
Mm.
And that hormone is a hormone that causes nausea and vomiting, and it is produced by the placenta at very high levels. And so, what we found is that patients with HG are at increased risk for getting HG if they have this gene for that hormone that makes them have lower levels of the hormone before pregnancy.
Mm.
So everybody has very high levels of this hormone during pregnancy, and so um, if they have abnormally low levels before pregnancy, then during pregnancy, when those it rises rapidly, they're not used to that, and so they're more likely to have nausea and vomiting.
Wow. Okay. So and it's from the increase amount is created in the placenta from the placenta.
Yes, by the placenta, exactly.
Um, okay, I have a couple questions about post-pregnancy, but at least during pregnancy. So the rapid increase, are you seeing that in the first week? Like how quickly are you seeing that intensity come on?
So it rises very rapidly in the first trimester and actually has a peak in the at the end of the first trimester, similar to HCG, which is the pregnancy hormone that you see positive on your pregnancy
Hmm.
test. So it was always believed that HCG was the cause, but we find no evidence for that. And GDF15 actually is the hormone that also has a peak early on in pregnancy when you have the symptoms of nausea and vomiting, just like HCG, but it also causes nausea and vomiting. So it is the most likely cause. Um, and so, yeah, so it rises and then it kind of steadies off in the second trimester. And then towards the end, it rises again. But we believe that there's a mechanism for desensitization. So you can get used to this hormone and get desensitized to its effects over the pregnancy um, for most people who have normal morning sickness. And so that's why it goes away. Um, in most people, but not in people with hyperemesis, where maybe they have something wrong with their desensitization
Hmm.
process.
Okay, right. Okay, so these are for people who it remains at a certain level of intensity throughout pregnancy. And then post pregnancy, right after delivery, what do you see in terms of the reduction in symptoms?
Yeah, so for the majority of people, they get better as soon as that placenta leaves, the hormone leaves the bloodstream pretty rapidly, and the patients, most of them feel almost immediately better once they deliver. Um, so there are some patients that do have continued symptoms afterwards that we don't understand why yet. Possibly from damage to other organs due to HG, would be my theory. But but yeah, so the nausea and vomiting symptoms generally go away, but then there are other persistent symptoms that can continue after pregnancy, including the trauma from the prolonged experience of day after day, night after night of nausea and vomiting and not being able to eat or drink properly in pregnancy.
Of course. I mean, you mentioned some of the things that it does to the body, but the after effects, the during effects and the after effects just it must take a long time to just really feel back to yourself or get back to normal health.
Yeah, definitely takes a long time for people to recover from this. Many people I've talked to have not recovered yet, even a decade after. It's just a very traumatic experience for many people.
Both physically and mentally.
Yes, yes, both physically and mentally.
Um, okay, so yeah, I have been able to support a few folks who've had very, very severe hyperemesis in their pregnancy that had these lasting effects that you're describing well into postpartum, like difficulties eating certain foods, being able to keep stuff down even afterwards. So at that point it's not like it's not called HG anymore, or would you still call it that?
I would say symptoms, prolonged symptoms related to HG. Yeah.
Right, right. So it's not that many professionals, as you alluded to before, like physicians, I should say, really know what to do or the best course of action. What do you what do you suggest? What are people doing that is actually helpful?
Yeah, so I strongly recommend that all physicians visit the Hyperemesis Education and Research Foundation
Hmm.
page. It has great resources from very experienced people, clinicians and nurses that made an algorithm for the treatment that's very detailed. It pretty much follows the ACOG guidelines, but goes into much more detail
Mm.
to help clinicians to treat their patients. And basically, Um, it's not morning sickness. Patients need medications on a regular basis, not just as needed. They need IV fluids. They need follow up. Um, because things can go south very quickly. So they really need frequent follow-up to see how they're doing and change the medications if they stop working, or add on medications. There are antiemetic medications that people use that do help, but it really varies from person to person.
Mm.
So, yeah, and then I like to also always recommend that patients, if they're unable to tolerate foods that have thiamine in them, vitamin B1, that they get a thiamine shot or dose of thiamine, um, because that vitamin um, deficiency can lead to a rare but very serious complication of HG called Wernicke's encephalopathy,
Mm.
which see we keep seeing happening in the United States and all over the world, and it is so cheap and easily avoidable with proper follow-up and just giving the patient the cheap uh, and affordable thiamine supplement. So, yeah, patients generally cannot tolerate foods that have thiamine in them, like
Oh.
meat and fish. So they may need this supplement, and that can avoid the swelling of the brain and permanent brain damage. It's
For
rare.
the
Some
carrier, for the person who's pregnant.
other, yes.
Okay.
So I think everybody who has HG and isn't able to tolerate those foods for a few days should be given a thiamine supplement, and it doesn't seem to be standard care for HG patients, and it should be just to avoid the rare occurrence of Wernicke's encephalopathy because it's so dangerous.
Mm.
So yeah, so that's another thing I recommend. The Her Foundation also offers support groups, so they have online monthly support groups.
Mhm.
So I recommend that people participate in those if they think that they would help them because it's a very lonely experience. Like I said before, patients are often bedbound and
Yeah.
definitely not go out and see family or friends. Often just the smells of people, even their
Right.
own partners, can and children can induce nausea and vomiting. So often they have to be isolated in a room by themselves. Can't enter the kitchen, or just do normal things. So, yeah, so they having a support group of people who understand that can
Mhm.
really help.
Mhm. Oh, right. I mean, I've heard some stories too of even, like you were alluding to, like providers not really understanding what's going on, so minimizing the person's symptoms, and like not being able to have support. If you haven't had it, from what I know, if you haven't had it, it's nearly impossible to understand what it actually feels like, and it's constant, right? There's no reprieve.
Yeah, so it's nonstop nausea and vomiting, and it's different than the stomach flu where you have nausea and vomiting and then you vomit and you feel better after.
Mm.
Um, Patients with HG will vomit and they feel worse after, and they can't brush their teeth. Can't even put a toothbrush in their mouth. So they feel worse after because what's making them feel nauseous is not something that's in their stomach. It's this hormone, and so vomiting is not going to give them the relief that is generally given to patients with something like the stomach flu. So it's really nonstop, and um, to wake up every morning feeling the same or worse than the day before, just really day after day, at a time when you're supposed to be eating well for
Mm.
your baby and you're getting a lot of pressure usually from family members to eat
Right.
um, and drink healthfully, and you just can't. It's really a harrowing experience.
Uh, right. So a lot of with the severe cases, you said people need to often go get fluids or have a feeding tube, but this isn't just like once, right? They might need to go multiple times for
Yes,
hospitalization.
so we actually started opening a clinic, the Harmonia Healthcare Clinic. It's a company that I'm the chief scientific officer for, that we just opened our first clinic um, in May, and we are hoping to open these across the country to get better treatment for people, because right now they're going to the emergency room. They have to wait for hours in the emergency room, which is not really a healthy place for a newly pregnant women to go.
Mhm.
Uh, and wait while you're feeling so ill, only to get IV fluids and be sent home and then return again. The majority return again to the emergency room for IV fluids. So,
Mhm.
yeah, so we're hoping that these clinics will be a nicer place for people to go, where they can get treated right away by doctors that understand HG, who are going to follow them up, so that they don't have to keep going back and forth to the emergency room.
That's amazing. So this is like a standalone clinic just for HG?
Yeah, so we opened the
Wow.
first. Yeah, hopefully we're going to be opening another one in New York by the end of the year, in New York City, and I think they will be open. It will change the standard of care, because it's really a broken model right now. You shouldn't have to go to the emergency room, and it is the second leading reason for hospital visits in pregnancy after preterm birth. So it's kind of shocking that this is the way that people are treated with this condition.
Yeah, it's horrible. I mean, the level of one patient that I know of was, having organ failure and really, really close to not making it. And it was like the physicians did not know what to do.
Yeah,
It's terrifying for them.
yeah.
I mean, it's not like they were doing nothing. They were doing everything they could think of to help, but at some point, I think a lot of people end up just trying to like Google stuff and what can they do to help, and going into forums and finding out how other people deal with it, because they're just not getting the care that they need sometimes.
Yeah, or the care comes too late and they're already in this severe vicious cycle. Uh,
Mhm.
so yeah, treatment and diagnosis needs to happen right away.
Mm.
There's not screening right now generally by OBs, and many patients go to their first OB appointment already after the period when HG starts, because the average emergency room visit week is week 8, and some people haven't even seen their OB at that time. So really, there should be um, screening right away. As soon as you get pregnant, you should be starting to screen for this.
Are there adequate screening tools that OBs have access to?
Yeah, but they don't really use them.
Oh.
It's not standard of care. Yeah. So there is the help scoring tool that was validated and created by the Her Foundation, the Hyperemesis level prediction score.
Mm.
So that's a tool you can use. It's available on the website. And then there's also the puke scoring tool that is used. So yeah, we prefer the help, because it addresses more questions, like intake, not just vomiting and
Mhm.
nausea like the puke score, but
Mhm.
both of those tools can be used to start to look at the levels and see whether a patient is um, needing intervention, because it's also that the patients often don't know that they need intervention. They
Mhm.
don't know that it's not normal. Uh,
Mhm.
or they feel too sick to really advocate for themselves and get the care they need, or realize that they're dehydrated. So
Oh gosh. Right. I mean, they feel terrible. But well, that's what's so challenging too, is that your body is going through this, massive amount of stress and strain. It's not really easy to think. I mean, you're not, yeah, just being able to process things as you normally would is not really available in the same way.
right, when you're starving and you're feeling terrible day after day, and you're
Hmm.
stressed about what is going to do to your baby,
Hmm.
uh, it's and you're dehydrated, yeah, you cannot think normally. So that's another thing that I forgot to mention that I recommend is getting an advocate. So have
Mm-hmm.
your partner or a friend, mother, somebody be your advocate, especially when you go to doctor's appointments. Make sure you have someone with you because when you feel nauseous, you don't feel like talking. And so you need someone to advocate for you.
Absolutely. I want to touch back on the research that you did. You were saying that if somebody has low levels of
GDF-15.
GDF-15, thank you,
Got it.
then that is the predictor. So, are there tests for that?
That's a great question. So we are working on that.
Hmm.
Uh, but this is all pretty new, this research. So we'll get there hopefully. But we need funding for more research to bring the new findings forward.
How do you get funding? How does that process work? Yeah.
Well, yeah, so I'm the CSO of Harmonia Healthcare, so we look to outside investors for that.
Mm.
But I also am a professor at University of Southern California, and there I apply for funding through the NIH. I'm
Mm.
applying for funding, and if people want to donate, that would really help as well.
Like donate directly to this project, or
They
how?
Yeah, they can donate to directly to my project. I
Mm.
have a link available. I can give you that.
Yeah, okay. I'll add
Uh,
that.
these studies are expensive. They take, you know, 100,000 to $1 million to do clinical trials, to do
Mhm.
studies, to identify biomarkers, to create tests. All those things, unfortunately, are not cheap. It's not paying a big, great salary for me. It's for paying to get these studies done. There's just a lot, and there's just a lot involved that needs to be done. So,
Right,
yeah.
and as I understand it, there's not a lot of research done on pregnancy in general, because hard to get those studies up off the ground because people are pregnant, and historically, it's really not been touched much.
Yeah,
So it's
and unfortunately, because of that, there aren't many researchers in this area. And because there's not many researchers in this area, it becomes a vicious circle because you
mm,
don't have researchers to review the grants. And if you don't have experts reviewing the grants, then they often don't get funded or they're less likely to get funded. So it's a vicious cycle.
oh my gosh.
Yeah, so it's really hard to get grants funded in this area in hyperemesis and pregnancy in general. So it's it's a daunting path.
Yeah,
Not
it's
good.
it's amazing that you've been able to do what you have done under all of those conditions. I mean, you were really doing the hard work. It's not just the studies that are hard, it's all of that behind the scenes stuff I mean, so much work has to go into this.
Yeah, I can't say it hasn't had its ups and downs and been very frustrating over many decades, but thankfully we're making progress and thankfully so far I've found some ways around it. I partnered with 23andMe for one of my genetic studies and
Oh, great.
their CEO is a woman, and so I think that, helped as far as their interest in supporting a study on pregnancy. Yeah, so
What do you know to be the current, I guess, statistics on how many people are dealing with HG?
well, one estimate is that it's about 2% of pregnant women, so 1 out of 50.
Mm,
Um, it really depends on how you defined hyperemesis.
mm,
It probably is higher than that just because so many people go undiagnosed.
mm.
So yeah, so I would imagine it's higher, but we really don't have a good way to estimate it just because, like I said, many people um, are not diagnosed.
That sounds like a huge number to me.
Yeah, it's our
It's
number. I mean, like I said, it's the second leading cause of hospitalization in pregnancy. So,
right.
uh, yeah, so it is. a large number of people that are affected by this.
And still, I mean, maybe this is just how women's health has been. Just not enough attention, not enough funding, not enough research, all of the above.
Yeah, and we just have to accept it, and, it's part of pregnancy, but, it shouldn't be part of pregnancy, and people shouldn't want it, if not for the mothers, for their children, because it now we know that it's leading to increased risk of adverse outcomes in the children, so,
Mhm.
if you're not gonna care about the pregnant women, which you should, uh,
Right, right.
at least care about the children, who are, also starving during pregnancy from this.
Um, wow. Uh, yeah, that's heavy. All of it is really really heavy. And you were talking a little bit about the after effects. So I've also seen how traumatizing this can be for people and is for people who are dealing with it. So not only dealing with the physical impact, that their mental health is really really impacted as well. Can you speak to that? What you've found?
Yeah, so we did do a study on post-traumatic stress symptoms following HG pregnancies, and we found that 18% of women had full criteria PTSD following their HG pregnancies. It was more common in the women that had it for all 9 months, as you
Mhm.
would expect,
Yeah.
because they're suffering for a very long time and starving for a very long time. And so, yeah, difficulty bonding with their baby then, and difficulty, performing all the tasks that they need to do as a new mother,
Mhm.
just becoming all the more difficult because of the prolonged symptoms during pregnancy and the severe symptoms.
And then do you in your study, how far past a birth were you finding that PTSD was showing up, or how far past were you looking?
We have not actually looked at how long these symptoms last. I mean, I know just from talking to people anecdotally that it can last for decades in
Mhm.
people. I've had people asking to participate in my studies that are in their 70s,
Oh,
or people contacting me in their 70s telling
wow.
me how they were affected by this and it was so traumatic. So
Wow.
uh, I know that it can affect people for a lifetime, just like any traumatic experience, um, especially because it's so ignored and undertreated, and
Mhm.
patients are treated like it's all in their head, and so because of that, I think they really can carry it with them for a long time.
Yeah, man, that all in your head thing that women have been put under for so long. It is mind blowing to me that somebody could say this is all in your head when, like, you can actually see that somebody is not well. It, that they're getting thinner, they're getting pale, they're having difficulty walking. All of those things. That is just not in your head.
Right, and these are people that have wanted pregnancies or even unwanted, but wanted and unwanted,
Hmm.
planned and unplanned pregnancies, and yet they're told that, it's
Hmm.
a conscious or even a subconscious rejection of their pregnancy.
Whoa.
Ridiculous, and
Whoa.
these studies have been done. For example, it was just changed the policy in France finally, but the recommendations by some doctors in France were to put the patient in the hospital in their own room in the dark, not allow them visitors, not allow them their cell phone, not allow them nursing care. So they had to clean up their own vomit. Um,
Oh my
and then
gosh.
the patients would say that they wanted to terminate because they couldn't take it anymore, obviously. But that was turned around on them to say, "See, we told you, you just wanted to terminate."
Oh my gosh.
Um, yeah, so this logic is just so flawed,
Mhm.
where they're torturing the women, even more than they're already being tortured by their own
Oh
bodies.
my gosh. That's horrible. And some people do terminate for medical reasons
Oh,
because it's that if they'll will die.
yes. So, at least 6% of the people in our study ended up terminating. Many of the times it's recommended by their doctors to have what's called a therapeutic termination because
Mhm.
for many people the medications are just not helping and they continue to lose weight and like you said get organ failure,
Mhm.
and so it has to be done to save the mother.
Uh, right. I mean, and right. How much trauma is that? Um, it's just mind blowing that this isn't taken more seriously. I mean, to the point where, so as a psychologist, I've had clients come to me and tell me that their doctors will not take them off of work. And so, since my license allows me to do that, my degree allows me to do that, they are, because they are also like mentally overwhelmed, dealing with PTSD, dealing with anxiety, dealing with depression. I can take them off of work, but like, why wouldn't a, a physician take them off of work? I don't get it. It's mind blowing to me.
Yeah, people only think of their own experience or their partner's own experience and think that it's just normal morning sickness. And like I said, it is not. And
Mm-mm.
just because you have not seen this experience does not mean that the other person is not having it. And this is a serious illness. And um, people, yeah, it's not a choice where they can work, they
Right,
cannot work.
right, right. Absolutely. So going back to funding to do more research, what do you want to do next, or what are you working on now?
So right now I'm finishing up a genome-wide association study on thousands of people from all over the world to really complete the genetic landscape of HG
Mm,
because while that hormone is the main hormone, there are other um, biological and genetic factors involved that could provide other therapeutic avenues to pursue. So
mm,
that's one thing I'm working on. I'm also trying to get funding, but have not so far I have identified some uh, genetic factors that may be involved in Black women and pregnant people. And so, Black women are more likely to get HG than white women. They
mm,
are more likely to be hospitalized and more likely to have a recurrence. And I think that there may be different genetic factors contributing. And so I really want to do a study to determine what those are
mhm.
so that we can be more equitable in our care in the future and in
Yeah,
our biological understanding of the disease. So I think that's really important. Um,
yeah.
and then I am I want to do a trial. I am applying for funding to do a clinical trial on metformin to treat patients with metformin. It raises GDF-15. So we
Mm,
think that we can give patients metformin prior to pregnancy, get them used to GDF-15 since metformin increases the levels prior to pregnancy to desensitize them.
right.
People trying to conceive, that would be a way that they could possibly prevent it. So I need funding for a trial for that. I was rejected in my first grant, but hopefully um, I will get that
Oh my
funding.
gosh.
I want to get that going as soon
How
as possible.
heartbreaking to just even so much work goes into writing the grant.
I also applied twice actually. So I applied to Jill Biden's initiative in women's health. And like I talked about before, I don't think that they had, I heard, maybe this is not true, but I heard this. anecdotally that they did not have a pregnancy expert to review the grants there, so that they did not accept any grants related to pregnancy. So, yeah, I wasted my time on that,
Oh my
uh,
gosh.
Mormon trial, but, I'm trying again. So,
Thank
hopefully
you for continuing to try.
yeah,
Oh
that's
my gosh. It's so much work. So, you you're doing a lot of work with her foundation, and I know that you were saying they offer a ton of resources. And there's a conference coming up. Can you tell us a little bit about that?
Yeah, so we're really excited about it. This is the International Conference on Hyperemesis Gravidarum. So it gets together all the international experts from around the world, and it's the fifth one. It's never been hosted in the United States.
Mm,
So this will be the first one in the US. So we'd love for people to come and join us. It's in a beautiful place in Ventura, California, in the beginning of November, November 6th and 7th, and right by the beach, right on the beach, pretty much. And we will be bringing together these experts from around the world. It's going to bring together scientists, clinicians, patients, patient advocacy groups, all to talk about the latest in research and clinical trials. Their NGM is coming, who has a new drug that they are hoping to trial for HG. They're studying to hopefully get that to, which will block GDF15 signaling in HG patients.
wow,
So, yeah, so there's going to be a lot of exciting research presented there. And, we need input from all stakeholders. So I hope that we can get more people to attend. And it's really a very, for me, very emotional experience to be around all these people that care about
mm,
HD so much because there's so few of them. So to get them all together in one place is really great and yeah, very
that's
inspiring.
amazing. So this isn't just for physicians. Can anybody come?
No, like I said, anybody can come.
Yeah.
They're usually attended by not just physicians, not just scientists, but also patients and patient advocacy groups come from around the world. I know definitely uh, patients and uh, and leaders of advocacy groups are coming from not just the U.S. but Australia and the
Mm,
UK,
mm.
other countries as well. So, yeah, it brings patients together from all over the world too.
Oh,
So,
that's beautiful
and
because
we like,
they need the support too.
yeah, and they get to meet each other
Yeah.
and to give input. We need patient input in these studies because, then the studies are done well. Without the patients' input, a lot of times these studies are really poorly designed. So,
Right. Right. So if somebody wants to donate to your research, how what's the best way for them to get in touch with you or to donate?
I will let me give you the link.
Okay. I'll
Information.
include
I
that.
think that would
Hmm.
be the best way.
Okay.
There's also a link on the Her Foundation for people if they want to donate to the Hyperemesis Education and Research Foundation, which does incredible work for
Hmm.
people with HG.
Okay. Great. Any messages, hope, or things you want to say to people who are experiencing it or anything like that?
Yeah, just know that there are people out there that understand and are doing their best to make progress for HG. And I am very hopeful that things are going to get better. I
Yeah.
am
Yeah.
marching on, and others
Mhm.
are marching on to make a difference for you. So
That's amazing. And after hearing from you, I am also hopeful too. The work you're doing is just so important and really, really amazing. And I'm sure being in it is, there's so much you're dealing with, but hopefully you can also feel what a huge contribution this is to moving this forward.
thank you.
Yeah. Thank you for being with us.
Thank you for having me.
All right. So now that we've learned so much and know that there is still so much to do in the world of hyperemesis, I've included in the show notes to this podcast a link where you can go if you want to donate directly to Dr. Fazo's research efforts. There's also a link to the International HG Conference on November 6th and 7th in Ventura, California. Please also go to the Her Foundation at hyperemesis.org, and you can also connect with Dr. Fazo on LinkedIn or Twitter. Go to the show notes for this episode, or you can go to wellmindperinatal.com and find Dr. Fazo's episode, where you'll also be able to access those links. If you know anybody who has suffered with hyperemesis, please give them the resource of the Her Foundation at hyperemesis.org. And also, please send along this episode so they can learn more about what they've gone through or what they're going through. Send it to family members, anybody really who can benefit from learning more about this condition, so we can make sure people get the help that they need. I thank you so much for being with us today. Until next time.